So today we'll be talking about probiotics. So probiotics are defined as live microorganisms thought to be beneficial to host organisms. According to the currently adopted definition by WHO, probiotics are live microorganisms which, when administered in an adequate amount, confer health benefits to the host. The original observation of positive role played by certain bacteria was first introduced by Russian scientist Nobel laureate Elie McIntosh, who in the beginning of the 20th century suggested that it would be possible to modify the gut flora and replace the harmful microbes with useful microbes. McIntosh, at the time a professor at the Pasteur Institute at Paris, produced a notion that the aging process results from the activity of petrification of microbes, producing toxic substances in large number. Proteolytic bacteria such as Clostridia, which are a part of the normal gut flora, produces toxic substances including phenols, indoles, ammonia, and digestion of proteins. According to him, these compounds were responsible for the so-called initial autointoxication, which caused physical changes associated with the old. It was also seen that the milk fermentation with lactic acid bacteria inhibiting the growth of proteolytic bacteria because of the low pH produced fermentation of lactose. Based on these facts, he proposed that the consumption of fermented milk would seed the intestine with harmless lactic acid producing bacteria and decreasing the intestinal pH. He also said that it would suppress the growth of proteolytic bacteria too. He also introduced in his diet sorbal fermenting bacteria called as Bulgarian bacillus and also found to have health benefits. Composition of probiotics. Probiotics can be bacteria, moles, yeasts, but probiotics are bacteria mostly. Among bacteria, lactic acid bacteria are more prominent. Lactobacillus acidophilus, Lactobacillus casei, Lactis, Salivarius, Plantarum, Bulgaricus are examples. So other examples include Streptococcus thermophilus, Enterococcus faecium fecalis, etc. So features of a good probiotic. A good probiotic agent should be non-pathogenic, non-toxic, resistant to gastric acid, adhere to the gastric epithelium, produce antibacterial substances, bile acid resistance, and effective probiotic should be strain specific. Probiotics and immune difference. So probiotics may be affecting the pathogens by means of competitive inhibition, that is competing for growth. They may improve the immune function by increasing the numbers of the IgA producing plasma cells, increasing or improving the phagocytosis, as well as increasing the proportion of T lymphocytes and natural killer cells. So this diagram explains how the friendly and unfriendly bacteria compete for development. Uses of probiotics. First is diarrhea. In gastroenteritis, an antibiotic associated diarrhea which results in the imbalance of the colonic microflora replaced by the antibiotics induced bacterial death. Microbiota alteration changes carbohydrate metabolism and decreases the short chain fatty acid absorption, and the osmotic diarrhea results. As a consequence of antimicrobial therapy, which leads to diarrhea, is overgrowth of potentially pathogenic organisms such as Clostridium difficile. Treatment is by using probiotic formulations, which includes Lactobacillus rhamnosus, which may reduce the risk of antibiotic-associated diarrhea, improve the stool consistency during the antibiotic therapy, and enhance the immune response after vaccination. Potential efficacy of the probiotic in AAD is prevention, and it's dependent on the probiotic strain used for the. Second is lactose intolerance. So lactose intolerant bacteria are lactic acid bacteria which are actively converting the lactose into lactic acid. With the ingestion of certain active strains may help lactose intolerance individual tolerate more lactose than they would usually have. Next is colon cancer. Some strains of Lactobacillus bulgaricus have demonstrated anti-mutagenic effects, thought to be due to the ability to bind to the heterocyclic amines and carcinogenic substances found in the cooked meat. May also exert anti-carcinogenic effects by decreasing the activity of the enzyme called as beta-glucuronidase, which can generate carcinogens in the vagina. Next is inflammatory bowel disease. Inflammatory bowel disease like Crohn's disease and ulcerative colitis may also be reduced when using these probiotics. It is used to reduce cholesterol and blood pressure. Lower cholesterol and blood pressure, presumably by breaking down the bile in the gut, thus inhibiting its absorption, which is entering the blood, and reduces in blood pressure, which is an effect which is possibly related to the AC inhibitors like peptidase produced during fermentation. Irritable bowel syndrome. Bifidobacterium infantis produce some symptoms of irritable bowel syndrome in women. Lactobacillus plantarum may also be effective in reducing IBS symptoms. Bifidobacterium animalis shows reduction in the discomfort and bloating in individuals with constipation, predominantly in inflammatory bowel disease. LAP produces products which might aid in the treatment of acute diarrhea and possibly affect the rotavirus infection in children and travelers diarrhea in adults. Used in peptic ulcer disease caused by Helicobacter pylori, vaginal infections, and probiotics may decrease the incidence of respiratory tract infection and dental caries in children. Probiotics may also exert beneficial effects on allergic reactions and improve the mucosal barrier function. What are the side effects of probiotics? Some side effects of probiotics, although rare, are systemic infection and lactobacilli causing system septicemia, especially in immunocompromised patients, acute pancreatitis, and excessive stimulation of the susceptible individual and gene transfer. Thus, the new strains used for probiotics should be evaluated for safety and food with probiotics: curd, yogurt, banana, strawberry, ice cream with probiotics, milk powder with probiotics. The spelling of powder is wrong. Kindly change. Factors that affect the viability of the probiotics in food. So, physiological status: dryness in a food product keeps the bacteria from a relative quiescent stage during storage, while a wet product establishes potential activity mechanism. Second is temperature. So temperature affects the shelf life of the bacteria, and with low temperature providing condition for possible long-term survival. pH. Some bacteria like lactobacilli and bifidobacteria can tolerate low pH values because they produce organic acids and products from the carbohydrate metabolism. In vitro and in vivo, studies have shown that the gastric transit, where the cells are exposed to low pH values, and with the time of exposure to relatively short, and some probiotic organisms can survive with this condition. Water activity. For quiescent probiotic bacteria, water activity is crucial determinant of survival in food products during the storage. The higher moisture level and water activity, the lower survival of the probiotics. Oxygen. Most bifidobacteria and lactobacilli are considered to be strict anaerobes, and oxygen can be determined by the growth and survival. However, the degree of oxygen sensitivity varies considerably between different species and strains. So, freeze thawing, shear force, growth factors, and protective and acidity may also play a role. Next is status of probiotics in India. Probiotics are used for human beings. Okay, and their most common ones are Sporolac, Saccharomyces boulardii, and yogurt. Sporolac is manufactured using spore lactobacilli. The lactobacilli solution is an example of a probiotic usually given in pediatric children in India. The latest and recent edition of list of probiotics in India is Vybac, which is made up of genetically modified Bacillus menestricus, which acts as an alternate for B complex capsule. In India, only sporulating lactobacilli are produced, and they are sold with some of the antibiotic preparation like Vizylac and amoxicillin. Thank you, students. I think this lecture would have been useful for you, and I can bet that you will not get this lecture anywhere in the world. Okay, so this is a long answer for MD microbiology students. I think that you should go through this lecture, sit back, read, and get knowledge. So thank you. Have a nice day. Take care.